And it is WesTex Wednesday. That means that Dr. Beck is here in our studio this morning to talk about some health news for us. And I think the topic we're focusing on today is costs that come with waiting to go to the doctor when it's a little too late and you should have gone earlier. Thank you for being here, Dr. Beck.
Well, thank you for having me. Good morning.
So, talking about costs, you know, when should you go to the doctor? I know a lot of people find their diagnosis online, or they wait, or they'll say, oh, I'll get better in a couple days, but what's the problems with that? Well,
I mean, there's a lot of, you know, pros and cons. I mean, because we have to think about cost, not just the cost to our health, but the cost what it is out of our pocketbook when we go to see a healthcare provider. But mainly what we're talking about is not the cost out of our pocketbook, but the potential health costs of delaying treatment. You had mentioned something about Google, and a lot of people like to Google their symptoms before they come into the doctor or to try to make a decision, and there's good and bad of that. What you have to take in consideration is that Google cannot take into account all of your health problems, all of your individual symptoms, and give you a correct or an accurate diagnosis always. You can maybe get a general idea, but if you're not sure and you're having symptoms, the best thing is to go get checked out with a medical provider. For instance, one of the things right now that's, of course, very common right now is the flu, influenza. The medications that we have to help treat the flu are only indicated if you come in to see the doctor within 2 or 3 days. I mean, and the sooner you get in, the more effective that those medications are. So, I mean, the flu will get better on its own within 5 to 7 days. You might be pretty miserable, but one of the things that we do worry about is potential complications from, say, the flu, things like pneumonia. Pneumonia, the symptoms, somebody may say, oh, I just have the flu, and sometimes people will use that term kind of in a generic way to describe some kind of upper respiratory or lower respiratory tract infection.
That's very true. Or, oh, I have a little bit of a cold, I think, but you aren't too sure exactly unless you go get it checked out. And a lot of people, they do know their bodies and things like that too. But still, very important to not wait until your body is heavily affected by those symptoms and it's dangerous. What other illnesses can people maybe sometimes think, oh, it's not a big deal, and then it turns into something that they should have gotten checked?
Yeah, I mean, you know, always things about delaying diagnosis, things like cancer, pneumonia, diabetes, hypertension, high blood pressure. Those are common things that unfortunately we see that sometimes people either they're in denial about it and they just it's like no news is good news to them. They don't feel bad maybe, or maybe they do feel bad and they're just afraid of knowing what the real truth may be, or what the cost may be as far as cost to their long-term health
and treatment. That's a big one.
Well, it seems like if you neglect treatment, and you're the expert, so if you neglect it for a while, it may start to rack up more from your pocket. Is that kind of usually how sometimes that works?
Well, not always. I mean, but, you know, of course, you know, medication costs money. But what we worry about is, you know, if, say, for instance, pneumonia. I've taken care of people who thought they had the flu for 2 weeks and they ended up having severe pneumonia where their infection had spread into their blood, and that carries a fairly high mortality. So when you take into account the cost there, we're talking about the cost. What is the cost of a human life? You know, if you're talking about diabetes or high blood pressure, there's lots of complications that can occur over time if you don't get good medical care. The complications from diabetes and high blood pressure, things like kidney failure, heart disease, stroke, that kind of thing.
So when in doubt, ask the doctor.
Absolutely.
Not Google.
Not Google,
WebMD,
and especially the stubborn first responders out there, or people working in the oil field who like to say, oh, it's just a chest cold, it's fine, I'll just drink water or tea. No, go get that checked out because you just never know. You also have some news, Dr. Beck.
Yes, we have our new clinic open in Odessa now. It's at 1941, pardon me, East 37th Street, just by Odessa Permian High School, down from the Social Security Administration office. Open 7:30 to 7:30 Monday through Friday, and weekend hours are a little bit different, 8 to 5 Saturday and noon to 5 on Sunday.
Definitely good, especially as you were mentioning with the flu. And I talked to somebody the other day, and they were like, "Well, I'll just wait it out." But if you do have any issues, you know, can you just show up? Do you take walk-ins?
Yes. We're walk-in only. We do allow the ability to kind of reserve a spot online, if you will. Just go to our website, which is www.westexurgentcare.com, and you can do that there.
Well, congratulations on your new location, and now people will be able to see you here in Odessa and not have to drive to Midland all the time.
That's
Thank you so much for being here this morning.
All this access right there. Well, don't forget to check out Dr. Beck if you have more questions. Thanks for being here, and also stay tuned. We will have more news and weather after the break. We'll also recap your top stories and tell you what's going on in the basin.